on the News Channel 5 network. This is OpenLine.
Good evening, everyone. Welcome to OpenLine. Thank you for being with us tonight. Tonight we are talking about medical debt, and we will also move into TennCare and the block grant proposal. I have Michelle Johnson from the Tennessee Justice Center here with me to take your questions and your calls. A great resource on this. Michelle, thank you for being in here once again.
Absolutely.
Every time our producer tells me that you're coming in to talk about medical debt, and I say the Justice Center, I have to reacclimate myself with what is the connection there?
Well, health justice. We know that every Tennessean needs a pathway to opportunity and dignity, and the only way they can do that is by having the peace of mind that they can access the health care they need for themselves and their loved ones.
We have taken a hard look at medical debt across Tennessee, and it really is a crisis, more so here than in other places of the country, and it affects so very many people. I read a statistic that said about 24% of Tennesseans that have a credit report have medical debt on that credit report. That's 1 out of 4, basically.
Yeah, and we're #1 in the nation at medical bankruptcy. So
wow.
People just trying to get through the day are being bankrupted by a sick kid or broken leg. We've got to do something to change that.
And it's not completely people who are uninsured. This
Absolutely.
can happen to people with insurance. So many plans are turning to these high deductible plans, and we're talking really high deductibles.
That's right. That high deductible plans, and also surprise billing. You go to the hospital, you go to your in-network hospital, you have a surgeon who's in network, but maybe the anesthesiologist or the lab are out of network, and then all of a sudden you have a bill for $10,000. So there are many, many ways that the healthcare system is just not working for anyone in this country.
Why is that? I think that's what people want to know. Why do I feel like the victim here?
Well, I think it's become very polarized and very political, and we have leaders who need to roll up their sleeves and start solving these problems. This isn't rocket science. We have solutions. We just have to find the political will to actually solve them. And Senator Alexander pushed a bill to protect people from surprise billing. It was a bipartisan effort at the end of last year to really make a huge difference on that, and there were lots of powerful people who crushed that effort because they have a financial interest in it, in stopping that. And so we have to look to our leaders to keep doing that, to keep taking the courageous actions.
Do you know from contact with his office, is this something he will continue to work on, or is it kind of DOA?
No, I don't think it's DOA. I think we have to just keep demanding logical solutions because most families cannot afford to basically lose their life savings because their child has a car accident or a bike accident, and we just have to, we have to do better. Our citizens deserve better.
And when you are dealing with medical debt, whether it be $400 or $4,000 or more, it really takes a toll on your life.
It absolutely does. It hurts your credit report, which makes it very difficult for you to get a car loan or a home loan, and so your ability to pursue the American dream is really hampered by the fact that you have this medical debt. You often will borrow money from a payday lender or other, and then it costs you more and more, and you descend into this really hopeless situation that isn't what we want for our citizens. They deserve better.
We just learned, we did a report, Chris Conti did last week, about how medical debt just even passes on to relatives. Once a person dies, if they have incurred medical debt, it's going to pass on.
That's right. That's right. And that isn't, it seems like we want people to be able to pursue. If they work hard and they follow the rules, they shouldn't be crushed by these sorts of things. I think the median debt that people who owe medical debt is over $700. That's huge when you think about most families in Tennessee are living paycheck to paycheck. $700 is really it's crushing, and we have to figure out a way, if they have insurance, that the insurance actually covers their medical care. And if they don't have insurance, because our elected officials haven't pursued expansion, Medicaid expansion, which would cover 300,000 people, we have to figure out a way to get those people covered. Those working poor folks that are, the waitresses and the home health aides, construction workers, and those folks, they deserve to have health insurance. And we know that if they have health insurance, in states that expanded, their likelihood of having medical debt goes way, way down. They deserve the peace of mind that the rest of us do as well.
Let's talk about the block grant. It is a term that is thrown out there, and I don't feel like a lot of people know exactly what is going on. Can you explain what is happening in our state when it comes between us and the federal government in the most layman terms that are out there?
Yeah, I think that the challenge is that healthcare has become this political football.
Yes.
And both sides think that they can get an advantage by using it as a way to say, by using healthcare. And the fact is, you don't go in the hospital as a Republican or a Democrat. You go in the hospital with a sick loved one or sick yourself, and you expect to be able to have your needs met without being financially ruined. So block grant is just another example of that. Medicaid expansion is an example where our Republican Governor Haslam proposed a plan that would bring, we've now lost $7 billion in federal funds to expand coverage. He proposed it, the legislature rejected it, but that wasn't enough. Now they're saying we want to reject more federal funds. So their talk is like $2 billion they would take out of Medicaid. $2 billion of money that right now is spent on children, half the people on TennCare are children, another substantial percentage are seniors in long-term care and nursing homes. I mean, people might be ready for their mother-in-laws to move into their house. I don't know, but this Medicaid is a vitally important partnership between the federal government and the state government. And right now, every time our costs go up, the federal government pays a little bit over 60 cents per dollar. The effort is to end that partnership, which will mean more people will be uninsured, and we know if you don't have health insurance, you're more likely to be a victim of medical debt.
And why do you say that more people would be uninsured?
Well, because the cost of Medicaid, we're the only state in the nation that's saying we would end this partnership.
We just want a block chunk of money to spend as we want.
We don't want to be held accountable anymore. Right now, we have the people who are covered by Medicaid are children, seniors, pregnant women with breast and cervical cancer. The Governor Lee has said he wants to take about $1 billion for himself, $1 billion to the Trump administration, and they will spend that money elsewhere. Now, I mean, right now we know that we don't have an extra $1 billion. So where's that money coming from? I mean, he said he doesn't want to cut. He doesn't want to cut services. He doesn't want to cut people. Well, you don't just magically get $1 billion. The Trump administration has said they want a block grant for the whole nation, and they hope to save $1 trillion in Medicaid. We understand it's a piggy bank. The federal government wants money. The state government wants money. My issue is that we have children in the state whose future depends on having comprehensive health coverage, and it's an investment worth making.
I know that there is talk that the TennCare rolls are going to be looked at and weeded out soon. Well,
they've already done that. You know, we have 220,000 children who lost coverage, and our Public Records Act request showed that 93% of those children, they did not make a determination on the merits of whether they were eligible or not eligible.
What were they making a determination on?
They said they didn't respond. So
people were sent some
they were sent a 98-page packet, and they said they did not respond. Now, we have clients calling us still to this day who never received the packet, who haven't moved in 10 years. We sent some of the packets back in ourselves, and they said they didn't get them. We sent them again, and sometimes as many as 3 times before their vendors actually said they got them. We have pretty much every week we have families calling where one child, they got the packet for one child, and then the other sibling, they didn't get the packet. So we have a hurricane of red tape that's hitting these Medicaid families, and these are, this is the future of our state. Half the kids in our state depend on this. Pregnant women need to have comprehensive coverage so they can get prenatal care, and our seniors who've done everything, made all the sacrifices for the state, they should live their final chapter with dignity without having to worry about spending their whole life savings.
You just said half the children in our state depend
on Medicaid.
That's true. To me, that says we've got a bigger problem than just what's happening with Medicaid.
Absolutely. I mean, we have to figure out a way to give people a living wage. And the truth is, even families who are pretty middle class, if they're offered health insurance for the employer, they often aren't offered health insurance for the child. And so we have lots of children in our state who are uninsured. And the fact is, the federal government says if we know 30 years worth of research shows us that if you give kids comprehensive coverage, they're more likely to go to college, they're more likely to earn more as adults, less likely to die of a preventable illness. And so we know comprehensive coverage for children is a wise investment, and we also know the private market hasn't done a whole lot to take care of those kids. But we need to pay people more, and we know that the average savings for families is not what it should be, and part of that has to do with the fact that if they go to the doctor one time or the hospital one time, then they have this medical debt, and the interest.
It's just a revolving door of problems that you can't catch up and can't get off that hamster wheel.
That's true.
All right, we're going to take a quick break. When we come back, more of this conversation. We'd love for you to join it with your questions about medical debt, what to do with it, what resources are out there, or what about this block grant? Where does it mean for you? Go ahead and give us a call. Numbers on the screen, 615-737-PLUS. Stay with us.